If somebody comes in with a diagnosis of chronic laryngitis, we are thinking of phonotrauma, shouting, throat clearing, screaming, lifting heavy weights and grunting. Smoking, whether or not somebody is a smoker will definitely affect the vocal folds. Whether somebody has reflux. We'll consider the patient's occupation, what kind of impact that might be having on their voice. For instance, teachers. Teachers are a very big part of our caseload because they work in poor acoustic environments. There's children shuffling chairs and papers. Often it's old buildings with rattly windows, things like that, and big spaces. So we look at the environment in which the patient is working. It might be a call centre worker with a heavy vocal load and no time to take vocal rest between calls, that kind of thing. We will also look at medical history, what the patient is taking, whether that impacts upon their voice, whether it dehydrates them, because anything that dehydrates is going to increase the closed phase of the vocal folds, creating wear and tear on the edge of the vocal folds. So medical history, occupational history, hobbies. People might have a hobby like a martial art, or they might go to a gym and do lots of weights where they're using a lot of forced glottal closure, things that might exacerbate the problem. We'll also look at family history. Are they a small family, a large family? Are they shouting up and down the stairs all the time, shouting from room to room? Or are they a quiet family? Are they in the car a lot with the radio on, competing with background noise as they talk to their children in the back of the car? So all these kind of environmental issues will also impact upon their voice, as well as whatever the pathology is and what sort of triggers that is giving them to increase their tension to compensate for whatever's going on. With chronic laryngitis, you want to decrease the friction between the vocal folds by increasing hydration, decreasing diuretics like coffee, tea, those sorts of things, avoidance of collision of the vocal folds by having vocal naps of 15 minutes at a time to rest it, and not throat clearing and not whispering. Hydration is going to be key, that the patient needs to make sure they have had enough free fluids, enough water, so that the vocal folds will be lubricated. Not that water touches your vocal folds, because it doesn't. If it did, you'd be drowning. But your body needs to have enough water in it that you can then lubricate your vocal folds. Your vocal folds as a woman are vibrating like this at 220 beats per second. In order for them to do that without friction, without an increased closed phase and effort, they need to be well hydrated. The other way of also getting some kind of lubrication is humidification. So steam inhalations, plain steam inhalations. Nothing in the water, plain steam. You can do it with a kettle and a bowl and a towel over the head, the old-fashioned way, or you can get a facial sauna, one of these plug-in electric machines that consists of a little tiny dish that heats the water to a consistent heat and a consistent steam. Breathe that in for 5 to 10 minutes, and that will help. The other thing is, when you've got chronic laryngitis, you feel some irritation, you want to clear your throat. That is one of the things to stop doing. So to avoid throat clearing. Now, it's very easy to be told, don't throat clear. Very difficult not to throat clear. So we give them another strategy. So the other strategy would be either sip some water or preferably huff instead. So to go and swallow instead of to avoid the trauma. One other thing that's really important in that first instance when somebody comes in with chronic laryngitis is not to whisper. So you might think you're being very gentle, looking after your voice by whispering. In fact, you're not. What you're doing is you're increasing the stiffness in the vocal folds and thereby actually potentially creating more trauma. So far better to talk very quietly than to whisper. In addition to keeping the voice quiet, vocal naps are useful. So 15 minutes of silence sporadically throughout the day, just as downtime, like if you had a swollen knee, you'd put your leg up to rest it. Where you've got inflammation, if you rest it for 15 minutes at a time, that will help. Okay, so as a GP, if you have a patient who is a professional voice user, like an opera singer or an actor or broadcaster who comes in with chronic laryngitis, we need to be super sensitive to their needs. Their needs are at an athletic level that is greater than the individual voice user who's not a professional, and they have an elite need as well. So somebody who is a singer will need the clarity and the specific sound of that note. So they have exquisitely aware tendencies, because this is their livelihood, this is their badge of honour, this is their self-esteem. So the first thing I would do is reassure them that this is something that can be dealt with, and I would apply all the same other things like steam and water, vocal naps, those sorts of things. But also you've got in mind that you don't want them to be silent and paranoid about what's going to happen to their voice, because if they're silent for too long, then we may get atrophy of the muscles, and they also will become very, very scared about not using their voice. So get them to therapy as quickly as possible.